today. We're going to be talking about, today we're going to be talking about the influence of the tobacco industry on youth, but also just in general, kind of the way that tobacco policy works. And we have some very great speakers for that here today. So I'm very happy to be able to introduce our two speakers. A little bit about me first. My name is Stella. I'm a second-year medical student from Vienna. In EMSA, I'm the national coordinator for Austria, and I've been working together with Rana, our public health pillar director, on coordinating this session. And I'm very excited to welcome our two great speakers. So first of all, we have Anka here from the Smoke-Free Partnership, which is one of the most important bodies of advocacy in this field. So welcome.
Thank you. Thank you for having me.
Thank you for being here. And then our second speaker is Laura, who is a human rights expert in the field and also an expert on tobacco control in human rights issues. And she has worked with Unfair Tobacco and numerous other organizations in freelancing. So we're very excited to have you here as well, Laura.
Thank you.
Okay, yes, so then before we kind of get started with the questions and kind of get started with our conversation, we'd like to just introduce the participants that we have in the webinar here today, as well as an interesting kind of opinion that we've gathered during the registration for this webinar. So during registration, we asked participants to which extent they think the tobacco industry has an influence on policymaking in their country. And we actually got an average of 6.7 on a scale of 1 to 10 of what the participants think about the influence of the tobacco industry. So I think this is a very interesting result. I'd like to ask our two speakers just right off the bat, what do you think of these results that we found here?
Maybe I start. So I think it's probably this perception is probably very realistic. I mean, there are countries where the influence of the tobacco industry is very low, and there are also many countries where it is very high, and an average of 6.7 is, I think it's about it's about the real life. So yeah, and maybe Anka can say something about the European Union on that.
Yeah, I think, in my experience working a lot with sort of EU institutions and also with a lot of our coalition members from member states, I mean, I agree with Laura that it varies from country to country, but it also varies, and we see this also at EU level, from field to field. So most often ministries of health are not as much influenced by the tobacco industry as ministries of economy or finance or agriculture or trade would be. And that has to do with sort of the understanding and the attitude towards the tobacco industry, and for the ability of seeing it as what it is, which is a vector of disease. So I'm starting.
No problem. No, it's great. Yeah, so that's great to hear that you kind of agree, or like that the participants have a good understanding of how the influence might be. So that was just kind of for the beginning to see where we stand. I think we can kind of go right into starting our questions right now. So before we get into actual questions though, I'd just like you to maybe each say a little bit about your background, how you got into this industry. I know that you both have kind of very different like ways that you probably entered this industry. Anka, you were very much in the policy realm, and Laura, you were very you were involved at a very early age, so that might be very interesting for the participants to hear how you got involved.
Okay, well, I'll start. How did I get into tobacco control? So about 15 years ago, I started working as an EU public affairs, as in lobbying consultant. And one of my clients was a healthcare company that was working on smoking cessation. And as part of preparing to work for that client, I started reading about tobacco control and the framework convention on tobacco control and how the different policies play into each other. And then I worked with that client for several years, and I got to know all the people who were working in tobacco control in Brussels. I'm based in Brussels. And at some point, about 8 years ago, almost 9 years ago, I was having lunch with one of them, and she told me, someone in my team is leaving. You wouldn't be happening to know someone? And I said, well, actually, I do know someone. And then a few months later, I started working in the Smoke-Free Partnership to support the campaign for the Tobacco Products Directive, and we did that, and then on its implementation and everything that's been following. And it's yeah, I mean, I got into tobacco control, not quite by accident, but what a wonderful accident it has been for me.
That's great to hear. Thank you.
Yeah.
Laura, how about you?
Yeah, so Anka joined as a professional, and I joined also about like 15 years ago. I came across this issue of tobacco companies. That was about environmental destruction, tobacco companies destroying forests in East Africa for tobacco growing. And I was a volunteer in a Berlin-based organization, and they told me, you know, we have enough to do for you for 20 hours, but my position was 40 hours. So choose something to do for the other 20 hours. And I was like, oh, well, I came across this issue of environmental destruction. Let me read more about it and write something. And then, yeah, by chance, there was a group of other volunteers. We came together to learn about how to do project management. And by chance, we developed a day of action on tobacco industry. And yeah, and that's how it happened. We did a day of action on World No Tobacco Day in 2004. And we got good media coverage. And, you know, we didn't know much. I mean, looking back, I think I was so naive. I mean, I was just, I was not even at university then. But yeah, we needed a name for this group, and we developed a campaign, and somehow this got bigger and bigger. And now this is still there as Unfair Tobacco. Yeah.
Yeah, I mean, I remember when I discovered smoke-free laws and environments, and discovered like the whole science around us. It was such a shock and discovery. Yeah.
Yeah, so it really is like a discovery that you make, and it doesn't matter at what age, but it's so great to see that you each got involved in a very different way, and it's very nice to see that. So Laura, you actually mentioned World No Tobacco Day. I'm just going to quickly touch on that because that is the occasion kind of for our webinar. So for anybody who maybe was not aware, yesterday was World No Tobacco Day, which is kind of a big, an important day for this policy realm, for this kind of topic, because it's really like, you know, a day where to raise awareness for the tobacco industry, for tobacco control. So that's really why we're very happy to hold this webinar and this occasion and kind of talk more about these subjects. So great, so then I'd continue for like a little kind of the baseline for what we're going to be talking about. Anka, could you introduce us to the tobacco policy? Kind of how is tobacco controlled in Europe?
You have several levels. Okay, I'll start from the sort of the top level, the global level, and that is the Framework Convention on Tobacco Control. The Framework Convention on Tobacco Control sets out a set of policies aimed at eventually, if implemented completely and together, eliminating tobacco. The FCTC just celebrated its 15 years anniversary, and it is our convention. It's one of the fastest, if not the fastest, embraced international treaty, and it sets obligations on the parties that have ratified it. It has 182 parties. That includes a lot, not quite all the European countries, not all the countries in the European region, but at least, well, anyway, most of them, and almost all of them, and the EU as well, and all of its member states. And you have two, you have 3 levels of obligations in there. You have the policy that reduce demand. So the policies that reduce the interest of people in buying tobacco. There's the policies that reduce supply, and that has to do a lot with fighting illicit trade, but also reducing incentives for production of tobacco. There used to be subsidies for tobacco production in Europe, and they've decreased tremendously, but they're not completely gone yet. So there's still, and then you have all over the world, you have tobacco cultivation with state subsidies. We're not there yet. And then there's a lot of provisions about investing in research and monitoring and understanding the epidemic of tobacco by countries and cooperating with each other to learn from each other. So this is the broad thing. But of course, this is about the best practices. And that then gets translated into national policy or into regional policy, as is the case with the EU. And then you have at EU level, you have 3 major directives. One deals with the regulation of products, one deals with banning advertising, and one deals with the minimum taxation. And then there are and these are cross-border aspects, and they require coordination. So they're dealt with at EU level. And then at the national level, you have the things that do not have a cross-border dimension, such as things like smoke-free laws, things like education programs, things like tobacco cessation. And then you also have the local level, depending on how countries are organized. So you'll have countries that ban smoking on, cities or regions that ban smoking on beaches, for example. So you have a lot of levels of regulation, and the FCTC translates in many, many ways. The one thing that, for me, brings everything together is about the politics and the political will for it. So
Okay.
I hope this is succinct enough. I'm sorry, there's a lot to say.
No, it was a great overview. It's obviously a very complex topic, but I think it's really great to kind of know a baseline of what we're actually dealing with in this field and what the kind of different institutions are that even play a role, what the different stakeholders are in this field. Yeah, so that's great. Maybe we can go right into the second question then, which is kind of to focus more about the topic of this webinar, which is tobacco industry targeting youth in essence. So youth obviously has played, tobacco industry targeting youth has played a huge role in the campaign of this year's World No Tobacco Day. So there was a very powerful advertising campaign, which, caused a lot of traction. So maybe some of you could comment on that, and let's see what you have to say about it.
Anka, do you want me to start?
Oh, okay. Go ahead, Laura.
So the problem about tobacco industry targeting youth is that they are using strategies to hook young people and people who are vulnerable and more susceptible to their messages on their products. And young people starting, people starting under the age of 18 or 21 have a lot more difficulties to stop later in their lives and also the statistics show that people who have not started to smoke by the age of 18 are very unlikely to start later on. So the tobacco industry has to target youth to get them to smoke. And they have been doing this for decades. And they have been doing a lot of research, which is also interesting to read because there are millions of tobacco industry internal documents online in the internal documents library. And yeah, so they actually talk about young customers as replacement smokers. So that's not made up, it's from a tobacco industry document. Replacement smokers, of course, also for all the people who die, the customers who die that have to be replaced by younger customers. Yeah, that's just an introduction to how they, well, let me also say something about the channels that the tobacco industry uses. So they have been using a lot of traditional spaces like billboard advertising, which is banned all over Europe in the European Union, except for Germany, which is still discussing this. Actually, it was debated in Parliament last Friday, so maybe we are going to have this now, 10 years after we should have had it, because we were obligated to introduce it by 2010. But there is also tobacco industry uses cinema spots, promotions at concerts and events, and more recently also on social media. They are paying social media influencers to show pictures of them smoking or vaping. And this is not, it's not always apparent that this is an advertisement. So this is being placed, it's a hidden campaign. And it's happening all over the world. Yeah, so maybe Anka, you want to add?
Yeah, if I could just add to what you said about the replacement smokers. Actually, in the WHO campaign, they directly said the tobacco industry is targeting children and adolescents to replace the 8 million people their products kill every year. So that was a direct quote from the campaign. That's really an extreme number. So it's definitely a problem. Anka, I'll let you go next.
Yeah, you see, I mean, this is where mass goes into place, because they're not just replacing the 8 million people they kill every year, they're also replacing the people who manage to quit. Mm-hmm. And if you assume that the smoking rates are going to be sort of steady instead of decreasing, then actually they're replacing more than the 8 million people they kill. And I do want to use these strong words because, this is exactly what's happening. I mean, we have a massive pandemic on our hands. And it's been going on for 50, 60, 70 years, this global pandemic. The other reason, a lot of the research that came out of the tobacco industry, but also independent research about the mechanisms of addiction, it does show that, and the industry knows that the earlier it hooks people and the younger they hook them, the more they'll have them as customers. So it's been long-standing behavior of the tobacco industry to target kids. It's well documented. the other thing that I wanted to do, and I'm going to mention, because Laura mentioned the kind of advertising that's still out there in social media. I'm going to share my screen because I have an interesting, let me find it. That's the one, sorry. Okay, can you see my screen?
Yes.
Yes.
It's through, oh, sorry, this is, I'm going to minimize this. This is through video streaming programs, right? TV shows. So you're looking at, this is a report done by the Truth Initiative, who are also the keepers of the internal industry documents. And you see, the explosion year on year of tobacco depictions in TV shows. Now, this is looking at Netflix, and because Netflix has really been striking in terms of tobacco depictions. But if you're looking, Stranger Things is a TV show about teenagers. Unbreakable Kimmy Schmidt, I mean, I don't know, I've watched it. I would not assume that its target audience is my parents, or not even my generation. It's funny, but or in other TV shows, I mean, The Walking Dead. I mean, what need do you have tobacco in a post-apocalyptic world? Like, is this really what people care about? Having after the zombies have invaded us all. So Modern Family. I mean, Modern Family. It's a family program. Like you're looking at all of these things. Percent of episodes in Netflix programs with at least one tobacco depiction. Every single episode of Stranger Things had some kind of tobacco in it. And I'm going to stop sharing because, sorry, I'm now going to, I don't know.
Yeah, maybe I can add to this something from France. They did a study on TV shows also. And the argument always is, we are showing just the reality. So we show people smoking because people are smoking. But then this study showed that they were actually depicting people smoking in restaurants and bars and places where smoking is not allowed in France. So this is not just about, we show reality.
Yeah, and then you have, I mean, I've shown you the TV shows, but then you have stuff like video games. And the way they do video games, I mean, I'm not talking about, bad guys in Grand Theft Auto. I'm talking about something more like, you're in a video game and I don't know, you're shooting zombies or whatever. This is what I play. I'm shooting zombies or whatever, and then with whatever money I get by killing zombies, I can buy stuff like a new gun, or I'm sorry, I'm glorifying violence right now. Never mind. I'm shooting zombies. That's what I know how to play. And then out of the add-ons that you can buy for your avatar, for your character, you can buy them a cigar or a pack of cigarettes, which serves no purpose than to satisfy your character. Okay? You're not killing new zombies with it. The zombies are dead already. But there's all of these sort of redundant depictions. They make absolutely no sense in the whole thing, and they're built in the story. I mean, this is working not by product placement with the producer of the show. You're working way upstream with the writers. They're integrating the behavior into the dialogue, into the story, and somehow miraculously, no smoker other than Walt Whitman in Breaking Bad ever gets a disease related to smoking. So it's really, it's product integration by now. It's not even product placement anymore. They're just going way upstream.
Yeah, that's so striking, because all these TV shows, video games are all targeted at youth, obviously. So it's really striking to see how how popularized smoking has become in these media.
It's
Yeah.
normalized. Yeah,
Yeah,
and it
definitely.
shouldn't be normal. I mean, that's the whole thing. It shouldn't be there.
And
Yeah.
I mean, we are talking about advertising budgets like 240 million euros in Germany alone. So I mean, it's just this, and look at the budgets that we have in the tobacco control movement. The tobacco industry can just, you know, sit down and be creative and be, you know, think about long-term strategies and just have a chat with a writer of a video game, and maybe it works out, and maybe, or maybe not. So you try again with another one. So it's, yeah.
Yeah, that's completely a valid point. That would bring me right into my next question, which would be about the human rights implications kind of that you see in the way that tobacco is being handled, because obviously the framework Convention on Tobacco Control is essentially based on human rights, the human rights, you know, to health and to, you know, just not being susceptible to all these dangerous substances in essence. So could you maybe, Laura, maybe you could say something about the human rights aspects of all this?
Yeah, so when I first thought about human rights, I usually think, oh, these are political rights like freedom of speech. But there are also lots of other human rights, like the human right to health that you mentioned, or the human right to life, or a children's right to be heard, human right to information, things like that. So governments, and these human rights are part of human rights conventions, treaties that have been ratified by lots of countries. And in the European region, that almost all countries, I think all countries have ratified human rights treaties, like, for example, the Children's Rights Convention and the Convention Against Discrimination of Women. And governments, these conventions place obligations basically on governments. They are only indirectly targeting companies, but it means that governments have to regulate, for example, tobacco industry and other third actors to protect their citizens from tobacco industry, for example. And I mean, it's quite obvious that the human right to life, for example, is affected by the tobacco industry. I mean, they are selling a product that kills 8 million people every year. But if we look even a little bit closer, then we find that tobacco use does not affect the whole population at the same level. So we have groups within the population that are more, that are smoking more and that have less access to quality healthcare. And for example, people with mental health disorders are dying decades. I mean, we're talking about 10 to 15 years earlier from, and many of them from tobacco-related diseases, and many more than the average population. And then also the human right to health. We are not also only talking about people dying from smoking, we are also talking about people being very ill for a very long time. I mean, you don't just drop dead from a heart attack. You might have COPD for decades and die really. I mean, it's painful. And the point is that the governments have to take action, and they are obligated to protect their citizens and to fulfill also the human rights that they have ratified. And tobacco control has been mentioned, not in the human rights conventions themselves, but by human rights committees that oversee the implementation of these conventions. And these committees have recommended or have said that governments are required to implement the Tobacco Control Treaty, for example, or to implement smoke-free public places. Yes. And my point often is about the discrimination of different groups in the population. For example, in Germany, we have much higher smoking rates among people who have lower income and less education. And the government is just, basically we are only implementing what the European Union requires us to do. And we have a little bit of a school prevention program, which is voluntary, and voluntary programs always have a better reach in higher income groups, because these schools have more time and more resources to deal with this. And this is just an example. I mean, we are talking about the whole world where the tobacco industry has a big influence on youth and on policy making, and the governments have, they don't just have the obligation to implement tobacco control. I would also say they have the right to do it, because the tobacco industry always argues, no, you don't have the right to regulate us because of, for example, the constitution, because of freedom of speech. You cannot regulate our tobacco advertising because that infringes on our freedom of speech. But it actually doesn't. Advertising is not freedom of speech. It's not information. It's just marketing. And human rights conventions, and also the inclusion of human rights in national constitutions, give governments the right to say, no, we also have the human right to health, and it weighs much, it has a bigger weight in this area than any freedom of commerce or something.
Very, very good point. We actually had a question in the comments, which is kind of ties into that. So Susanna asked, to what extent are youth aware of the fact that the tobacco industry is trying to target and influence them? Do you know something in that direction?
There are youth surveys regarding tobacco use. They don't necessarily measure the awareness of being a target. What we've seen in recent years is that, at least in the EU, youth smoking, and by youth I mean starting before it's in the group 15 to 18, that's actually grown. It went up. So I think, I'm not going to say they are aware or they're not aware, because there's just not enough information about that. And in general, there's fairly little awareness of the tobacco industry's marketing and advertising tactics, of the drivers behind the business, and of what we're discussing right now is not necessarily common knowledge. What I would add about the education point that Laura was saying was that I do not remember actually listening to what my parents were telling me about the risks of smoking when I was a teenager and I started smoking. Being educated about smoking is dangerous did not necessarily do it for me, because it was so normal and it was everywhere. And because now I have young kids, I'm realizing that raising my kids in the middle of a supermarket and telling them that they don't actually need to shop for a lot doesn't work. as as well as I would like to, because you get conflicting information, and when you get the information smoking is bad, and then you see everybody smoking, your brain automatically is going to go with the smoke, with this hope. It's not going to be so bad if everybody does it, no matter what my old crazy mom is saying.
I mean, actually, how can they sell something that kills? I mean, it can't be true that it really kills, because they are selling it everywhere.
Yeah. And
Somebody
look how
asked at the
pretty it
beginning.
is.
Yeah. Somebody asked in the beginning, if everybody knows that it's harmful, why can't Commonwealth organizations and World Health Organizations or United Nations completely ban on production and stop the companies? That is kind of, you end up asking yourself, why?
Yeah, I don't know if you watched the video clip that was shared before the webinar, but there was a group of German students, 6th graders. So they are, I mean, they are little, they are like 12 years old or something. And they demand that the government stops the tobacco industry from selling these products. And they have sent this appeal to the United Nations Children's Rights Committee. I mean, we will see what the committee responds, but there is no global organization that could ban tobacco. This is something that needs to be done by governments, and it needs to be done in a very smart way. It cannot be done just, overnight. Now we are going to ban tobacco. It doesn't work like that.
Unfortunately.
But we can do everything to make this, I mean, it's still profitable. How can this be profitable? It shouldn't be. And we can do everything to make the tobacco industry stop selling it, because it shouldn't be so easy to sell, for example.
Definitely. I'm gonna go on to another question from the chat, actually. So somebody said, it sounds like what you were saying is that tobacco industry is now targeting transnational avenues such as Netflix, social media, etc., to advertise, that are harder to regulate at a national level where there is more regulatory power. How likely do you think it is that the global community will come together to tackle this? Is there widespread awareness of these new avenues that they are exploring among policymakers?
We're working on that.
Yes.
It's actually something that we're working on as a health community, both as part of the global community and in terms of bringing these to the attention of policymakers. There is ongoing work, evidence-based work, to develop guidelines precisely for the regulation of transnational advertising and promotion through social media, through entertainment, through TV shows, through video games, whatever we could think of, and to try to adopt a set of evidence-based recommendations. And that is ongoing work, and hopefully it will be adopted at global level as a guidance to all governments by next November.
Okay, that would definitely be good. So I would now kind of like to go into the way that we might be able to change this, maybe in a public policy health kind of setting. So do you see any ways that there would be ways for the policy realm kind of to work in order to reduce the influence? And people in the comments are actually asking also specifically to reduce the influence on youth.
Well, we have so many instruments at hand through the Tobacco Control Treaty. These are evidence-based. We have guidelines that give countries very good explanations on how to best introduce policies. for example, a tobacco advertising ban, and not just a billboard ban that we are now eventually discussing in Germany, but a comprehensive ban that would be a very good way of decreasing influence by the tobacco industry on youth, but also everything that denormalizes the tobacco industry, like, for example, smoke-free public places, comprehensive laws that ban smoking in bars and restaurants, on playgrounds, on beaches, yeah, everything that denormalizes the tobacco industry. Also, some people say this belongs to the tobacco advertising area, but it also belongs to the influencing of governments, corporate social responsibility projects, and social functions by the tobacco industry. Banning these would be very helpful in denormalizing the industry.
Mm-hmm. Anka, do you have any opinions on this?
I would leave it to where Laura left it, and also because I was slightly distracted by one of the questions that was also asked. But that's your role as a moderator to
No
to
problem.
ask.
I was just gonna I was gonna do the transition to the next question, actually. So we can then take the question asked by Claire, which is, when the prevention ship has sailed and a youngster started smoking, what would motivate them to quit? What kind of information do they respond to, for example?
And that's exactly the one I was looking at.
That's
and there was a
good.
previous one from Bram, which is very similar, about encouraging smoking cessation in kids, in young people. So look, I'm not giving up on prevention. So first of all, Claire, with all due respect, I am not giving up on prevention. It is true that the prevention policies are not always 100% effective, unfortunately. And yes, occasionally the ship has sailed and the barn is open and the horse is running away. So there is some data, and a few years ago there was a pan-European campaign on quitting that was targeted precisely at young smokers in the sort of 20s, in their 20s, so not very well established smokers, but smokers nevertheless. And there are a few types of messages that have made their way onto the packets, for example. They have to do with, not necessarily with the death and disease, but with the attractiveness of it, with the impact on fertility, with the impact of on kids, because the sort of mid to late 20s, early 30s is also an age where people are thinking about starting to have children and thinking about their the kind of healthy life they want to have. So that was one of them. So there's this concern that is also now part of the health warning on packets. Another evidence-based type of message that we're well aware of is the social acceptability, and that's where we see the effectiveness of things like smoke-free environments, and the impact that smoking can have on your social life if you're one of the, if you're the only smoker in your social group, and having to go outside. So that's the second one, and then with the whole sort of budget impact of this, it's bloody expensive, and it wasn't as expensive as it was a few years. Sorry, it's more expensive now than it was a few years ago. But still, your daily smoker is going to spend, €1,500 on their tobacco every year. I mean, think of the nice holidays, that can buy, or the great books, or video games, or whatever. So that was also relatively efficient argument, when you put it just in, plain old money terms. So we do know there are some things that work. Of course, not everything works with everybody. So you have micro targeting and that sort of thing.
Well, it's also to add about the price. I mean, that is one of the most effective measures that we can take, increase tobacco taxation, and it will stop youth from starting to smoke because it's just too expensive then. And it will help people to quit smoking because it gets more and more expensive for them and they feel it. Just to add on that. And also what I would also like to add about prevention projects with youth. At my former job at Unfair Tobacco, we did projects with children, which is one of the projects is the one that I mentioned before with the sixth graders sending a message to the United Nations. And what I found, I mean, there is no study, no evaluation about this, but what I found is if you empower children and young people to do something, if you don't tell them just, smoking is bad, but if you tell them about the tobacco industry tactics and then empower them to take action, that makes a huge difference for people.
Definitely. We have an interesting point by Natasha in the comments. So she asks, if we consider that current youth are motivated to be conscious of the impact of the environment, do you think that campaigns focusing on its polluting factors would be more effective, since we can see that educating youth on healthcare effects doesn't seem to be working how they should? Do you have any thoughts on that?
It's a very good point. I think Laura knows more about it than me, but I think it's a really, really good point.
Laura, do you want to comment?
Well, yeah, I mean, I came from that area, right? I see from social media posts, for example, and also from giving presentations to just, normal people, not tobacco control people at conferences. People care a lot about cigarette butts, for example. Because, I mean, that is something that you see littered everywhere. You see it all around, and it's dirty. And then if you add the information that it's hazardous to the environment, yes, people care a lot about that. I am not sure how this works as a prevention message, but yeah, I also know that young people care a lot about the environment, and it plays a little bit into what I said before. If you empower people, if you tell them, if you give them the arguments that they need and the information that they need, and then, I mean, that's a very good action that a class, a group of people could take. Go out there and protest about it. Talk to smokers who just littered their cigarette butts or something. And it keeps, yeah, it will be something that they remember. And also, I mean, the point about the environment is if you stop people from smoking, you will not have cigarette butts. I mean, if you help people quit, and if you, for example, increase taxes so that people don't start to smoke, you will not have the environmental harms.
Great. So what you said about empowering, that's actually something that we wanted to touch on as well. So how do young people get empowered to advocate on this topic? What are your suggestions, especially since you, for example, Laura, got involved at such a young age? Maybe what's your advice to other young people to kind of speak up in this area?
Well, so the good thing about starting at a young age, I thought I know a lot. I didn't know much in hindsight, but I thought I know enough, and I knew enough to start and take action. And I would also recommend to just do it and not don't ask for permission from, I don't know, authorities. I mean, of course, if you start a protest, you need to inform the police and everything. Okay, but don't ask for permission for your opinion, and start researching. I mean, it also depends on which age you are at. I mean, we work with this group of children, and they needed some support to do it, to do this call to the United Nations Children's Rights Committee. But as a student, you have more resources and more knowledge, and you can come together and ask your friends to do something. Also, I mean, you are a young people's representation. So what you can also do as an organization is always to engage in, for example, in human rights reporting. You can also send a report to a human rights committee and tell them about the lack of healthcare or the lack of tobacco control policy in a specific country. And I'm also happy to, you know, if you want to do this as EMSA, for example, or as a country organization, I'm happy to guide you through this and also give a workshop or something.
That's a really great offer, thank you. We will definitely talk that over. That would be very great for EMSA members to get empowered in this area, which is so relevant at this time. So thank you very much for that offer, definitely. Anke, what is your kind of advice to young people in the policy realm? What can they do to advocate?
So, you know, when you have a hammer, all you see is nails. No, but I mean, a lot asks, but don't laugh. You know, my point is more about political activism. It's about demanding action that increases your protection from the tobacco industry. About you know, like the cycle of policy, if you want, to start with information and knowledge, and then that changes attitudes, that changes behaviors, and then it changes policy as well. And my point is that policy remains, and it remains including when you're not young anymore, because believe it or not, you will also grow old eventually. Never grow old in here, but you know, yeah. But my point is, policy is there to stay, and tobacco control policy has a fantastic track record of not being weakened. Once it's adopted, it stays, and then it grows stronger. It never gets weaker. There are some exceptions, very few, and they only prove the rule. But just to put that there as well.
Yes, it's true. And even if it's weakened, you see populations protesting about it because they want the stronger laws back.
Because I mean, fundamentally, that's why we have elected policymakers, so that, I mean, we entrust them with the idea of making the right decisions for us, okay? And the fact that trust in the public authority is eroding is not necessarily a reason to expect any less than that. So I don't think we should go like, oh yeah, but you know, this government is pretty crappy and corrupt. It doesn't matter. It's its job. You know, that's why we put it there. That's why people go to vote, and you know, collectively they do the best they can at any given moment. But policy will stay there for people who are going to be kids or teenagers or young people or adults or old people later. And that is also what then reinforces the attitude and the perception change. So I'm a big believer in policy. So what I'm saying is, go talk to your policymakers, write to them, ask for that. Come and join the coalitions that we've got at European level, at national level, and join your voices, because there's already a lot going on in there. You don't have to reinvent the wheel, but come and join and make your voice heard.
Exactly.
Thank you for that great call to action. That's very good. Definitely for everybody to hear. So don't shy away from, speaking up in any way, be that, through personal activism, through speaking to higher institutions. Anything that you can do is definitely worth it. Yeah, so I think from my side, that would be it for my questions. We're almost done, but we have some few more minutes for any other questions. If somebody has something they would like to ask, we can unmute you as well if you would like to say something in person. I'm just going to give it a moment. Otherwise, does any one of you have any closing words that you'd like to say?
I think Anka did very well with her closing words. Yes.
I think so too. Okay, so that's very great. Okay, I don't see any questions in the comments right now. If anything more comes up, just write something, but if not, that's fine. I think we had, yes, exactly, Rana's typing it right now. Feel free to ask any questions. We're going to actually show you our email, well, Rana's email that you can email anytime if you have any questions. We would be happy to kind of answer any questions that you might have. Obviously, if Laura or Anka would be happy to do so, we can put you into contact as well. So just
Yes.
In case anybody, great. So I think everybody's very welcome to kind of support your activism. Everybody would encourage you to, really speak up in this area. Yeah, so we hope that you enjoyed this webinar today. We hope that you learned something new. And I just want to thank our wonderful speakers once more. It was really a great discussion, great conversation here. I'm very happy to have had you here. Thank you for joining us for this session. So yes, that would be it from my part. Thank you very much.
Thank you.
Thank you. And thank you also to all of the great participants who were here. We really enjoyed your interaction. I think it was great. It was very, very interactive for sure. And it was great to have you all here. So thank you very much, everybody.